The UniCAP AKR knee resurfacing system from Arthrosurface is comprised of two components. The femoral component is a cobalt chrome articular bearing surface with a titanium taper post that is connected via Morse taper. The cemented tibial component is an ultra-high molecular weight polyethylene with interdigitations on the bottom for cement fixation. We will prepare the tibial side first by making a portal a little larger than a standard ACL portal. Select a template and place it over the defect. You must leave a 5 mm bone wall between the anterior tibia and the template, and also the medial wall and the medial side of the template. There is a selection of tibial templates with different curvatures in the anterior-posterior and medial to lateral planes, which you place over the defect and choosing the one that gives you the best recreation of the tibial plateau curvatures in both planes. Attach the template to the tibial drill guide and reinsert, creating a stab incision on the distal tibia for insertion of the bullet. Align the guide arm anterior-posterior and insert the 2 mm drill tip guide pin through the bullet and exit at the center of the tibial template. Remove the bullet and the tibial guide. Advance the tibial pilot drill over the guide wire and through the tibial plateau. Be sure to avoid reaming into the femoral condyle and remove the hardware. Advance the introducer until the proximal tip of the introducer is flush with the cartilage. The next step is to insert the threaded blade stop, which will become the depth stop for the tibial cutter, so that we can create the optimal socket depth for the implant. The blade stop is inserted over the introducer until the laser marks on the driver handle are aligned with the laser mark on the introducer shaft. Proper placement of the blade stop is when the tip of the introducer is flush with the cartilage on the plateau and the laser marks are aligned in the driver shaft. Remove the driver and the introducer, leaving the blade stop in place. The tibial cutter shaft is then inserted through the blade stop and the tibial cutter blade is inserted into the blade holder. The longer longitudinal slot should be facing posterior on the blade. Advance the tibial cutter swivel up and through the center of the blade. Rotate the shaft 90 degrees and pull back. To lock the blade, advance the yellow slide locking hub up and over the hub and release the lock. Remove the tibial blade holder. Begin counterclockwise rotation of the blade to normalize the blade to the tibial plateau, and then clockwise rotation will cut the cavity. Continue until the blade is stopped by the proximal end of the blade stop. Insert the tibial trial into the portal and place over the blade. Confirm the orientation of the tibial trial so that it is flush or slightly recessed medial to lateral and anterior to posterior. If the trial is proud, leave the trial in place and using the wrench, attach it to the blade stop and a 90-degree rotation will lower the blade stop by 1 mm. reattach the drill, ream to the new depth, again stopping on the top of the blade stop, and confirm the fit of the tibial trial. When satisfied, remove the trial. Remove the blade and tibial cutter shaft. Preparation of the tibial side is now complete. Turning our attention to the femoral side, place the femoral drill guide on the distal femur. Pushing on the handle will deploy the stabilizing feet medial to lateral. Establish 4 points of contact which will establish perpendicularity to the distal femur. Advance the femoral guide wire to the laser mark. Remove femoral drill guide, leaving the guide wire in place. Advance the femoral centering shaft over the guide wire to the depth where the laser mark line is at the height of the original articular surface of the femoral condyle. Using the medial to lateral contact probe over the centering shaft, place the contact probe on the medial side and record the number, which in this case the number is 3.0 millimeters. Placing it on the lateral side or medial to the condyle, the recorded number is 2.5 millimeters. Remove the medial to lateral contact probe and insert the anterior to posterior contact probe and repeat for anterior-posterior curvature. Here the anterior number is 6.0 millimeters and for the posterior number is recorded as 5.5 millimeters. Determine the average anterior-posterior number, in this case 6.0 millimeters, and determine the average medial to lateral number, which is 3.0 millimeters. If in between sizes, round to the larger size. The femoral surface reamer is selected based on the medial lateral value, in this case a 3.0 millimeter reamer. Ream over the centering shaft until the reamer bottoms out or stops on the centering shaft. Remove the centering shaft. Select the proper guide block based on the mapping point selected from the anterior-posterior curvature, in this case a 6.0 millimeter guide block. Insert into the femoral guide handle and again push on the handle to deploy the medial to lateral stabilizing feet. The guide orientation should follow the cam of the femoral condyle. Insert the pin sleeves into the guide block and confirm that all 4 points of contact on the drill guide are on the femur, and insert the small threaded pins precisely to the laser mark. Using the Jacob's chuck as a drill stop here is an effective measure. Remove the pin sleeves and the femoral guide. Proper pin location is when the small threaded pins are at or within a millimeter outside of the central reamed circle. When satisfied with the placement,